I will make a face.
It's the start of chilly weather and the start of the flu and cold season. Everyone gets sick. Whether you have an immune system of steel or you catch every bug that flies around, it's important to know and understand the information. Being in the medical field myself, I find that a lot of people get misled or mistaken with simple facts about the cold or flu. So today, I'm going to give you some general information. Today I'll talk about the symptoms, give you some treatment options, and a few prevention tips to help you keep safe and healthy. First, I'll explain the difference between the cold and the flu. There are many common symptoms between the cold and the flu. It's the degree to which they occur which differentiates them. It's important to know because it can affect your treatment options. Flufacts.com states that the cold comes on gradually. Common side effects, or not side effects, common symptoms are runny nose, cough, sore throat, and sneezing. And you may also be tired or achy. Flufacts.com also came up with a cute acronym that you can memorize to remember the common symptoms of the flu, and that is FACTS. F is for fever of over 100, A is for aches, C is for chills, T is for tiredness or fatigue, and S is for the sudden onset. Also common symptoms are coughing, which can be severe, and headaches. But you may also get a runny nose, sore throat, and sneezing. As you can tell, a lot of their symptoms overlap, as do the treatments. When we were little, Mom's soup used to cure everything, but nowadays the number of meds you can take can be really confusing. Everyone wants to get better fast, but sometimes it's better in the long run to wait off the symptoms and not go to the doctor to get a prescription for antibiotics. This is because Dr. Gelfand from WebMD states that not only do antibiotics not help, but using them when not necessary can lead to growth-resistant strains. Antivirals also help the flu virus, but the CDC recommends only high-risk populations such as the elderly, very, very young, or anyone with a suppressed immune system take them. These will shorten the flu by 1 to 2 days if taken as soon as the onset. So it basically prevents the flu from getting out of hand for those who are very at high risk. Greg, my boyfriend, has worked at a pharmacy for multiple years and says that it's best to just treat the symptoms with over-the-counter medicine. And everyone's different, so what your friend uses may not help you. You can also follow your mom's old advice. Stephanie Silk, writer for Health.com, says the best way to get better is drinking lots of water to stay hydrated and to get lots of rest. Also, be nice to your friends, family, and coworkers, and stay at home to help not spread the bug. Also, cover your mouth when you cough or sneeze. There are just as many ways to prevent the cold and flu than there are to treat it. It's very simple to prevent the cold and flu. The biggest is to wash your hands. EverydayHealth.com says the type of soap doesn't matter. You could use dish soap, hand soap, but the common thing to get right now is the antibacterial soap. And this is just a hype. Antibacterial soap is great in clinical or health professions, but because it disinfects and deletes all the bacteria from your hands. But because it kills both good and bad bacteria, it leaves the resistant bacteria over, and then the good bacteria can't kill that resistant bacteria, so you could actually get sicker. So the good news is the cheap soap works just as well. You just have to be thorough. If soap and water aren't convenient enough, you can use a sanitizer with an alcohol base of 60 to 90%. Also, to prevent the cold and flu is sleeping enough, eating right, and exercising. But as a college student, I realize that busy schedules sometimes don't allow it. Preventing is simple, but sometimes not easy. Today, I talked about the important information of the cold and flu. I listed the difference in the symptoms, I gave you some treatment options, and a few prevention tips. Remember, if you have any questions, to talk to your doctor or pharmacist, because the flu or the cold can get worse and turn into sinus infections or ear infections. Thank you.